Yeah, I think if it's a closed fracture, there's no exposed bone through the skin. If you can do that, that's probably ideal. It is very necessary if you have a significantly displaced or angulated fracture that's putting pressure on the skin, and the skin then is at risk for losing its blood supply and dying. So I think, yes, aligning the bone as best you can for comfort and for preventing, again, further soft tissue injury. If you can do that in a closed fracture situation, I think that's a great idea. Not a lot of people can do that. I think if it's an open fracture, you have to be very careful. If the bone is poking through the skin and the tip of that bone is contaminated with dirt, leaves, whatever, it's probably not a good idea to try to pull that bone back into the skin envelope, because what you're doing is introducing bacteria, dirt, and things into the skin envelope, and that probably isn't good. So if you can't do it, if you have any sort of concern, surely splinting the injured limb in the position it's in is reasonable. If you can straighten it out, align it a little bit better in a closed fracture situation, I think that's a good idea, as long as you're able to do that, but be careful in open fracture.